can become death, the destroyer of worlds.
We are back with another episode, and today we have my guy Kent on, and he's going to be talking about some veterinarian stuff, some other stuff, I'm sure. But first things first, let's go ahead and just introduce yourself and let the people know a little bit about you.
Yeah, so I'm Dr. Kent Morton. I've been practicing medicine for about a little less than a decade. It's a second career for me. I was in advertising before that. Uh, Went to school initially for broadcasting, actually.
Oh, nice.
So that was my first career. Went back to school in my early 30s, and now here I am. So
Nice.
yeah, I mean, as far as that goes, that's about it.
Right. Well, I guess we can start this off with my first question. So what made you go from broadcasting to medicine?
Good first question. Uh, so you're from Michigan, right?
Mhm.
I mean, we just know each other through Lions fandom and Twitter.
Right.
So I was, there's no regional, need to stay a Lions fan. So I was just
Right.
making sure. But if I remember, you're somewhere around Kazoo.
Yeah. Yep.
Um, yeah, so I mean, you were old enough to remember the Great Recession and everything, right?
Oh yeah.
Yes, and I mean, Michigan got hit hard and got hit first
Hmm.
because like the big three and everything. So I graduated university the first time in like '05, '06,
Okay.
right when things started to go to hell in Michigan before everything else hit. So like finding a job
Hmm.
really wasn't easy. And, a lot of my classmates did. It boiled down to I would have had to have left the state of Michigan to really find a job.
Gotcha.
I went back, I used to work at the Palace.
Okay.
Um, I was a suite server at the Palace. So, like, after I left advertising, I was working my job there, and me and my girlfriend at the time were like, well, fuck it. Uh, um, Packed up all our stuffs, got our travel visas, and went to Australia for
Oh wow.
a little less than a year. Yeah, I was in my mid to late 20s. Um, Down there, I just kind of got interested in animal medicine, or well,
Okay.
like animal science in general, like because we'd go to all the wildlife parks, and
Hmm.
I went cage diving with a great white actually.
Damn.
And my initial goal was I had thought about going back to school and getting a doctorate in marine biology and just live the rest of my life on the boat.
Mm.
When I got back to the States, I started working at a vet hospital doing like some marketing, trying to help them out, and I just got really interested in it and decided to start taking some classes.
Wow.
um and I wasn't telling anyone at that time that I was going to try and be a veterinarian, because like if it didn't happen then I like
Right.
failed and I'd have to like, well, I just failed. And uh but I was at a wedding and an uncle asked what I was going back to school for, and the same girlfriend who went to Australia with me was like, oh, he's going to be a doctor. And that my uncle was like, said something to the effect of like, I know a lot of human doctors who couldn't make it as veterinarians. Like, what makes you think you can do it? And then, so like someone told me I wasn't going to be able to do it. So I, at that point, was just there was no failure wasn't an
Right.
option.
Right.
Like I kind of spited myself all the way through vet school.
That's hilarious. Wow, man, that sounds like you've lived a life, you know?
I mean, I've lived in the Caribbean, I've lived in Oz.
Wow.
So like I've got some, I don't know, I've got some travel under my belt. Like yeah, I mean, it's been fun.
Yeah,
But like, like everyone's got their story, right?
that's very true. So my next question is going to be, how was it going to college twice? Because I'd
Oh my
assume
God.
that must have been.
Well, and like what really sucks about it is like, I mean, don't get me wrong, I make fine money, but like I went into a field that isn't really like the highest paid for the medical
Mhm.
professions, but carries a boatload of student loan debt.
Right.
Um, which we can get into later. But so like I really lost a lot of earning potential in like my late 20s, early 30s because I was in school. Like all of my money went to keeping me in school.
Right.
I did manage to get out of undergrad without having to take out loans, but people don't really realize like how much the cost of like I did my undergrad the second time at Wayne State.
Mm.
Um, so like that's supposed to be the cheapest school in Michigan.
Hmm.
And at the time in like 2010, I was paying like $3,000 per class.
Oh wow.
Like, yeah, like it's insane. Like, and I mean, when you try and consider like that's like 9 grand when you're making, $12 an hour, like
Right.
trying to pay that 3 times a year is almost impossible.
Yeah, that's insane.
Um, so yeah, I was able to get through it without any undergrad loans, which is nice, but um it's depressing how little like a college degree really gets you these
Yeah.
days. Like, because I mean, we're my generation was told like just go to school and get a degree and everything. Like,
Hmm.
my dad literally was like, just get the degree. Like that's all you need. What is
Right.
the degree is like what, and so like we all went to school and got a degree and like whatever we could get a degree in. And now people are like, well, you should have gotten a degree in something better. And it's like, well, think you fucking told.
Right.
I listened to the advice I was given.
Right.
So I mean, like that's it. But I mean, don't get me wrong, like I'm a big proponent for education, but
Hmm.
like it is, cost benefit analysis in
Yeah.
the States at least.
Yeah, 100%. And I can kind of speak from my story, if you want to call it that.
Yeah.
Like similar where I never was going to go to college. I was like, hey, that's not for me. I barely made it through high school. I graduated high school from an alternative, so I wasn't even like a good high school student. And so I like just my whole life I've been working odd jobs and doing random
Uh-huh.
things. I never really saw myself as, a career type of person. Other than, football. That was really the only thing that I liked enough,
Yeah.
to put in the work. But I got into coaching and everything, and then I got at this new school and I got a job as a paraprofessional.
Okay.
Which if I don't know if you know what that is, but for people that don't know what that is, basically I'm like a teacher's aide, right?
Okay.
Essentially. I work with um special ed specifically.
Okay.
So long story short, I never saw myself doing this. I was like, I'm gonna need a degree to make any money doing this. Turns out the year I got hired, made it so you don't have to have a degree anymore.
Oh,
So,
that's nice.
back to your point though of how they're kind of not discrediting, but devaluing education in some ways, because
Yeah.
I feel like, there's so many people that normally would go to college but now they're not, or they are and they're just going for a very wide range of a major, you know what I mean?
Yeah.
So I feel like it's kind of a good thing for people like me where I couldn't have made it through college anyway. I would have failed probably. I just don't have the work ethic for school. So it's nice for
Yeah.
people like me to where we can go get a job that pays well, and now I have a career.
Yeah, absolutely.
All I had to do was pass a test, really. But it's
Okay.
also bad for those people that went through that. They went to college, they did all the things they were supposed to do, to then be told when they got hired, yeah, you didn't need that anyway.
Yeah,
You
and
know,
I imagine they for your specific situation, they probably do have to pay the people with a degree more.
nope.
No, really? Okay.
Yeah, it's
Because
it's kind of weird, honestly.
like for in my career, like let's say you were to come to my hospital and be like, hey, can I work as an assistant? And I can
Hmm.
like train you on the job. And there's certain things that you're legally not allowed to do,
Right.
or you have to do specifically under my guidance. But I can't pay you as much as I pay someone with depending on the state, an RVT or
Yeah.
CVT, certified veterinary technician.
Right.
Because that's like a nurse, so they basically have a nursing degree.
Yeah.
So you would always have to remain like a little bit underneath them. So it is kind of nice that they, kind of got rid of that requirement. It's not
Yeah.
something that I see needing it's not something I see needing a 4-year degree, but most things don't need a
Very
4-year
true.
degree. Like, I mean, so much of college, in my personal opinion, is just a cash grab. Like, why did I have to take like um uh, God, I took African American film because
Mhm.
I needed a film elective for my initial degree. And I was like, why did I need that? Like, that's
Right.
not so like there's stuff like that. And it's like, back when that was, $200 to take
Right.
that class, that's fine. When it's 3,000, like,
Yeah.
come
You're
come on.
forcing people to pay for something they literally don't need, but you say they need it. Like it's like a
Yeah.
scam, at the
Yeah,
end of the day.
no,
They're
and
like, you need this piece of paper in order to make money, but I need your money to get this piece of paper. What are you
yeah,
gonna do?
absolutely.
It's
And
a very weird thing.
so I mean, don't get me wrong, like I am very, very fortunate to have gone to school twice and to
Mhm.
only be in the amount of debt I'm in, and most of that
Right.
is from my graduate degree. Um, but uh like, and I'll never put down like the value of an education, because there is just value to you going to college.
Mhm.
Because it does help you grow up a little bit. Like,
Mhm.
the idea though that we ask like an 18-year-old kid to go to school, and it's like, okay, pick what you're supposed to do for the rest of your life.
Right.
Like, I mean, that's why I've changed so much, right? Like, at this point, and when I was like 25, my goal was to be a media mogul.
Right.
I
Right.
wanted to like own broadcast media and like go from there. And then now I just want to make stupid noises and play with your dog.
I
Like,
feel that. I feel that
so
totally.
like that's it. It's all about just, a lot of it's I grew up, and
Mhm.
to your point, you said you probably don't have the mentality to go to college. That was me.
Right.
Like, when I went to college the first time, you know, I was always like a really I could do really well in high school with very, very minimal effort.
Mhm.
When you get to college, that doesn't really fly.
Right.
Um, so like I didn't really have like a great college. I graduated, I passed, but I just wasn't really willing to put in the effort. Um, when I wanted something, I was willing to put in the effort, and I wanted to go to vet school. I wanted to be a doctor. So much of that was just learning how I need to study.
Mhm.
Um, and like, the hours and upon hours of studying time I put in. There was I was working through most of it, and then I left my job right before I got into vet school, and my GPA went up from a 3.3 to a 3.7 just because I was able to just focus entirely on school.
Right.
And I mean, it's just, yeah. So like I said, you'd be surprised if you want something, you're not more than willing to put in the hours
Mhm.
sometimes. Like, but when it was just like, I'm going to just get through this so I have a piece of paper to put on my resume, like,
Right.
there wasn't that drive to be an exceptional student or anything,
Yeah. And that totally makes sense. As I personally, I've been looking into college a lot more recently,
Hmm.
because of, the path my life has taken, where now I work in education, and, in order to kind of climb that ladder in education, you have to have a degree. Because
Absolutely.
like I want to be either uh like the head of the behavioral department, or like the physical education teacher. And in
Yeah,
order to be
absolutely.
either of those, you have to have a degree. The only thing standing in my way is the 4 years. If it was 2 years, I'd do it. But 4 years,
Yeah.
man, I'm gonna be almost 30, like by the time I'm done. And I
Dude, I
just
didn't
don't.
get into vet school until I was 30.
Oh, okay.
So like, I mean, yeah, so I got out of vet school when I was 34.
Right.
So like, I mean, the only if okay, like it's easy for me to say because I've done it and I've been through it, and now I'm, on the other side of it, and
Right.
I make a good living, and I have a job that I enjoy, and whatever. Like I've done the work and I've gotten there. Um, that being said, like first off, your job might pay for it.
Yeah.
Always look into that.
Yeah.
Secondly, all you're doing by saying like, well, I'm gonna be 30 when I get done is postponing you doing it. Like
Yeah.
there's no.
Yeah. That's very true. And I feel like for me, honestly, like if I was a- I don't even know how to say it really. If I was a few steps back in life, I probably would do it. But the
Yeah.
fact that like I just bought a house, I'm like coaching football, like, and it's like I don't know if I'd have the time or the financials, to be able to swing it really. And
And
that's the struggle, really.
that's why I would, because a lot of companies, I'm sure that the school you work for has some money set
Hmm.
aside
Yeah,
for situations like your own, because clearly they like you, they hired you,
right,
and it's cheaper for them to pay for you to go get a degree than to go and find someone with that degree
right.
if you're going to stay long term. You'd be surprised. Like my brother has two master's degrees and he didn't
Wow.
pay. Well, yeah, like he has a program through one of his jobs. He just had to stay there a certain amount of time.
Hmm.
And they would only pay for so much if he held up a certain GPA. So
Right.
it took him 2 years. He had to work the full time, but he, did online classes and everything. And
Hmm.
they're both from MSU. So like he got like a really good deal. So if that money's out there, you're not doing yourself any favors by,
Yeah.
not looking into it.
That's very true. And actually I was recently not offered, but I got an email from where I work saying that they are giving degrees for special education teachers.
Yeah.
And it's only like a year and a half and all these things, but with the commitment that they want from you, it's like I couldn't coach. And
Oh,
that's kind
really?
of, yeah, that's kind of where I'm at, where it's like, I don't like football is why I started getting into education. Like, that's the
Yeah,
whole reason.
absolutely.
So I couldn't see myself even taking a year off to get that. You know what I mean? Like,
Yeah.
it just feels like I'd be going backwards, which I know, at the end of the day, I'd be going forwards financially and I'd have a degree and everything. But also,
Mhm.
I don't know if special education is necessarily what I want to stay with, you know.
And again, if the degree is out there and it's free, then it's not necessarily like there's no downside to
Yeah,
it. And so
that's
you
true.
wouldn't necessarily be taking a step back either. You'd just be taking you'd be slowing down progress. But
Right.
hopefully the goal is like with me, you slow down that progress, but then you take a big leap forward when it's all
Mhm.
over.
Yeah.
Um, I mean, and don't get me wrong, I'm not someone to take life lessons from.
I
So
mean, hey, you're speaking some facts right now. So, I mean, it all makes sense. And that's the thing. That's kind of the dilemma that I've had with that, is like there it really does make sense to do it. But then again, at the same time, it's like just another like big commitment to take on,
yeah,
and like really it's the time issue because it's going to be a second job basically because they
yeah,
crunch it all in so it only takes a year and a half. So it's like I'd be going to work from 7 a.m. to 3 p.m. and then going to school from 3 to 6 minimum. And it
yeah.
just is
And
like,
then you got to study and
right.
whatnot, and you got to
Yeah.
figure all that out. The only thing that I would say is like, okay, so they crunch it all in, but like, how long is your football season? Like, because you're not coaching football in January, right?
I mean, no, not technically, but I will say football is the only year-round sport in my opinion
Really?
because oh yeah, it's like we've been doing practice once a week every week for the past like 2 months.
Okay,
And
because I was
and I
gonna
mean,
say I know the NFL's year round, like
yeah,
they never take a break, but
yeah,
like college sports,
right.
I well that's different because you're recruiting and everything. So like coaching, there's a lot more work that I
Yeah.
don't know what is involved with high school sports though.
Yeah. I mean, it's definitely not like a full-time year-round commitment. You know, the season starts technically August 1st and ends like mid-November, but that's when you're full-time. So like August 1st, you're 5 days a week, 6 hours a day for 2 weeks, and then you go to regular, weekly practices. But I mean, I feel like I could swing it. It's just I would definitely have to take a season off. And
Yeah.
I don't know if I want to do that unless I am forced to, unless I get fired and I just can't find another job or, something happens. Then I'd be like, okay, now's a good time. But like, that
Yeah.
really is where I'm at. Like coaching, I think is my career and like the
Uh-huh.
education is like how I make my money, if that makes sense.
Yeah, no, that's
So,
fair.
and
And I mean, like, but that's what you're passionate about, right?
yeah.
Like,
Oh
I
yeah.
know, I mean, the entire way I know you is through like us talking shit about the Lions on
Right.
Twitter, so or X now,
Yeah.
or the hell you call it. But like, so yeah, I know that you're super passionate about it and whatnot.
Right.
Um, so and that's go with your passions, right?
Yeah,
So
for
that's
sure.
great. And I mean, uh, and even coaching can end up being a career.
Yeah. That's kind
Like,
of way I'm looking at it is like coaching is my career. That's the thing I'm going to focus on. And then
mhm.
I'll do this stuff and still, be good at it so I can keep a job. But like, that's basically all that it is like that's how I pay my bills. And then coaching is what I enjoy. So I do it because I enjoy the coaching part. But
Yeah, absolutely.
so enough about me. Let's talk about you. So my next question is you kind of already answered this because my first question was going to be how did you become a vet? You
Mhm.
basically already told me, but like I guess my next question would be um what was the hardest part about becoming a vet? Outside of having to go to college twice.
God. Um, I mean, the whole thing's kind of hard. Like,
Mm-hmm.
um, one of my favorite things all through vet school, like your professors are all like, "Hey, you're becoming a doctor. Did you think it'd be easy?" And like now that I'm a doctor, I'm like, "Yeah, it's kind of easy." Uh, like, I mean, for most part, like, I mean, I do general wellness, right? Like, so I do illness and diagnostic appointments. I do surgery and everything. But for the most part, like 60% of what I see in a day is healthy dogs, healthy cats.
Right.
And answering questions about like what should I feed them? My cat's doing this. My dog's doing this. Why is that? Like stuff
Mhm.
like that. Um, and so like for the most part, it is pretty easy. So actually, like being a doctor, kind of an easy thing. But um the hard part, getting into vet school was difficult, and that took a lot of perseverance. I got my um first rejection letter. So I had to apply twice. I got my first rejection letter on New Year's Eve
Oh wow.
in 2011. And um, was just like so like just down. I was like,
Yeah.
I'm gonna okay, put everything together, apply again. Um, and then the next year I got waitlisted at MSU.
Mm.
So like basically they said, oh, we had because every vet class is about 100 students.
Right.
And they're like, oh, so we have 100 students we liked more than you, but like if we don't like one of them, if one of them goes somewhere else, like maybe we'll take you.
Right.
um anyway, so I got in eventually, but I was waitlisted at MSU, which was where I really wanted to go. I wanted to stay in Michigan.
Right.
And then like MSU called me like 2 weeks later and was like, oh, like, we had a couple drop out. So did you want to come? I was like, no, I've already gotten to school. So I mean, just like trying to keep your head up because
Hmm.
I mean, all in all, I probably got 10 rejection letters because you apply to about 3 to 5 schools per time.
Right.
And like every application you send in costs money. So
Oh yeah.
like the whole application process is probably about $500 back in
Jeez.
2010. It's probably like $1,000 now. And so like you spend, $1,000 and then you just sit there and wait for forever because
Right.
took like 6 months, and it's probably, I think it's faster now. I mean, I was kind of applying to it at the advent of every school starting to digitalize their application process and streamline it. And some
Gotcha.
schools want you to come in for an interview. So like, there's times you have to, like, I drove to Chicago, because that was like the closest office with someone I could interview, and
Oh wow.
like left work because I was waiting tables at that time. I left work at like 7:30, drove all the way to Chicago, stayed in a hotel, got up, interviewed the next morning at 10 a.m. and left there wanting to die. Uh, and then I had to go up to East Lansing on like a whim because they don't really give you like a lot of um, uh, planning time because
Right.
they've got to get everyone in too. So they're like,
Yeah.
okay, hey, we're going to interview, because every year, every college has about 1,000 applicants and they take 100. So they've
Right.
got to, in the 6 months time that they do this, they've got to streamline it down um, from 1,000, cut away 900 people.
Right.
The I forget what the test is called that we have to take like for applying, like some standardized test like the SAT, but it's not that.
Yeah.
I realized my window to I am horrible at like planning my steps. Um yeah, like I realized about 2 weeks before I had to take that test in 2 weeks. And
Damn.
so I like bought real quickly like the whatever most popular study program there was,
Right.
and spent all of that time just like cramming for it. And I ended up doing like an 80th percentile, which is like really good.
Yeah.
But it was 2 weeks of just nonstop studying. And
Damn.
um and then your clinical year is terrible. That's probably actually the worst part. Um, so like your clinical year is where you're a baby doctor, right? Like you're
Mm.
doctoring, but you have a professor who's kind of like, your guidance and whatnot.
Right.
And those are just long days. Like I like to tell this story because it gives you a good example.
Mhm.
So I got 3 days off, the 23rd, the 24th, and the 25th of December, and then I had to report back to my emergency rotation on the
Mm.
26th. So like on the 22nd, there's going to be a group of students that come in and take over like the cases that you have still hospitalized.
Mhm.
So I round the student that's taking over for me, which is just where, like, if you were a doctor taking over a case, we call it rounding.
Right.
I'd be like, hey, Jace, like I have a 5-year-old male neutered Cocker Spaniel presenting for, blah, blah, blah. We did
Right.
these procedures on it. He's on these meds this many times a day, yada, yada, yada. So I round that student and I left, and it's about 4 o'clock, and I was like, wow, it's a really early day. And then I
Mhm.
realized, because I was talking to my roommate, that we had already been at the hospital for 12 hours.
Oh my gosh.
Yeah. So we were there from 4 to 4. And I mean, there was times I remember walking into one of my large animal rotations at 5 a.m. And my rotation mate, his name was Alan, was just sleeping at the computer
Wow.
because he was on call, and he got called in to do a colic surgery on a horse. And so like probably happened at like 11.
Mhm.
Surgery probably finished up somewhere around 2 or 3 a.m. I don't remember offhand. But then like he had to do all the paperwork that came with it.
Right.
And he had been, going straight for 24 hours and just fell asleep. They have tried to make that better.
Yeah.
I do know that for a fact, but that was like the worst part is like you really don't have any sort of agency. I had my girlfriend at the time was visiting and we went grocery shopping because I was like had to buy groceries because I
Right.
hadn't been home, and I got a call and it's like, hey, like you're needed in the surgery suite, and I'm like, I'm really not. Like someone
Right.
else is gonna cut it and close it and do everything, and I'm just gonna sit there and monitor anesthesia and do paperwork. Like
Right.
I'm really not needed. You just don't want to do your paperwork.
Right. That's
So
wild.
like those would be like the worst things, or just
Yeah.
kind of getting in. Once you get in, I mean, staying in is hard too.
Right.
Like because it's a grind, and like, so is it there a hardest part? Not really. It's all a grind.
Gotcha.
I mean, there's a reason that a lot of us don't make it out. Because I think my class started with like 170,
Mm.
and when you look at people that I graduated with, it was probably around 120, and we probably gained about 20 to 30 people from other classes. So you
Gotcha.
figure like almost 100 probably didn't make it, at
Wow.
least not in my same graduating class. I did
Right.
end up staying in the same semester through the whole time, which is not entirely uncommon, but again, there's no shame in it. Some people
Mhm.
have a hard time adjusting. Some people just don't click with certain material,
Right.
and struggle with it. And every semester, I was pretty sure I was getting kicked down to the semester below me. So,
Wow.
and then you get your grades back, and you just be like, oh my God, I made it. And
Right.
like, so, and not everyone did. And a lot of times, they went on, they still are graduated and still are great doctors.
Mhm.
But there's a saying in vet school is C's get degrees.
Hey, facts.
So
I feel that.
like you just got to pass your class. You know what they call
Mhm.
a doctor who got C's?
A
A
doctor.
doctor.
Right. I feel like I actually, funny enough, I feel like I just heard that for the first time a few days ago. And I can't remember
Really?
what it was, but I think I was watching a movie or something. And they were talking about like, I don't want a doctor that barely passed, blah 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 blah. And then the guy was like, you know what they call doctors that barely passed? Doctors.
Yeah.
So
It's very true. And
yeah.
I mean, like, one of my mentors always said, if you remember 1/3 of what they teach you, you'll be an excellent doctor. Everything
Mm.
else we teach you how to look up. Because
Right.
like I mean, in human medicine, there's no, and human medicine is like incredibly specialized, right? Like,
Mhm.
so I was on a plane talking to a retinologist, so like a doctor who only works on the retina of the eyeball, and I asked
Right.
him a globe question about the eye. I was like, hey, do like human eyes, do they do this, and he's like, oh, I don't know. And I was like, what? Like, you're an eye doctor? And he's like, I'm a retinologist. I only
Right.
work on the retina. And I mean, so like, if does it really matter if he knows anything about the stomach? Like,
Right.
that's not important to him. With me, like, I can't know everything. I can't be great at everything. Like, I'm a
Mhm.
dentist, I'm a surgeon, I'm an internal medicine doctor, I'm your family practitioner. If there's something I can't handle, I can refer it out, like, because there are oncologists and
Mhm.
ophthalmologists, name a specialty and we probably have it. There aren't
Right.
retinologists. But yeah, there's surgeons. So like, I mean, there's surgeries that I certainly wouldn't think that I'm qualified to do. So if there's something I think that I can't handle surgically, I can always send it to a board certified surgeon.
Gotcha.
Two of my best friends from vet school are actually both board certified surgeons now because that's all they want to do. They
Nice.
don't want to do anything but cut animals for the rest of their life.
Wow. It's a profession.
Yeah.
Um,
So like, yeah, it's just impossible to know everything. So like if you get through it, you get through it.
right,
And then if yeah, like I mean, all of us have imposter syndrome. And I always try
right,
to remind people that like, anyone you've ever looked up to in your life was at some point in your same shoes. Like I'm sure there's a football coach that you're like in love with. Um, one time he was coaching high school football.
right. Oh yeah.
Like, and like, oh, why do I deserve to be here with these other really good high school football coaches? And
Mhm.
it's they weren't born being, Bill Belichick or something like
Right.
that.
I
Or
mean, shoot, Bill Belichick himself got fired a handful of times.
yeah,
Oh, I
and well, he
mean,
just got no,
fired
he
again.
stepped,
Yeah.
but yeah,
Yeah.
yeah, but like I mean, yeah, but like he's got 6 Super Bowl rings, and right now
Mhm.
isn't working at all. But
Right.
there was a time where he left the Cleveland Browns, and
Hmm.
was probably really hard on himself. He wasn't thinking
Hmm.
about winning 6 Super Bowls at that time.
Yeah, that was pretty
Um,
true.
so like just yeah, I always try to remind people, when you're kicking yourself and don't think you can do it, remember every single one of us was at a point where we didn't think we could make it.
Yeah, I mean, that's very true. All right, so kind of leading off of that question, my next question is, so what is currently the hardest part? I mean, I have a guess, but what is the hardest part that you have to deal with right now?
I bet your guess is euthanasia. Um, I tell people that part's hard,
Hmm.
but it can be really rewarding. Um, the the hardest part for me is when an animal leaves that I know is suffering and the owner turns down euthanasia.
Oh
Um,
yeah.
because that and I tell people I have a very specific, because of course I have a fucking story. Uh,
Hopefully.
so um I had this woman come in and her dog, she's like, my dog's struggling to breathe. And she tells me through history that about a year ago, it had been diagnosed with an enlarged spleen. So generally speaking, it was a golden retriever, older. Generally speaking, that's a type of cancer that we call hemangiosarcoma.
Okay.
Which if you're going to get cancer as a dog, don't get that one. People like hear cancer and they think like, oh, it's cancer, it's terrible. And like, yeah, it's like, I mean, some cancers can be cured with just removing a mass.
Right.
Others are like aggressive and metastatic. And so cancer isn't a disease, it's a category of diseases. This is in the bad side of that category. Anyway, so generally speaking, like without treatment, without aggressive therapy, 2 weeks, maybe a month.
Wow.
And like, well, she tells me my dog got diagnosed with an enlarged spleen a year ago. So this dog has been on borrowed time for 11 months.
Yeah.
Um, anyway, we did x-rays and this dog just had x-rays are all about reading the shades of gray. The whiter the material, the more dense it is.
Right.
So we take a picture of this dog's chest and its lungs are just white, which it should be black. Like there should be a lot of air in there and air comes up black. Um, so I'm talking to her and I'm like, you should really put this animal down. Like, this is like the absolute worst case scenario. Like you're not getting more time. And she's like, I need a minute. And I'm like, yeah, certainly. Like, I can't force anyone to, and you certainly don't need to make a decision in front of me, right?
Right.
Um, well, I go back in. She's like, I'm taking him home. And I'm like, I mean, he's going to die. Like, if I let you walk out of here, your dog is going to die, and they're going to die in the worst way possible. Like, they cannot breathe. Like, imagine like drowning in your own body tissue.
Yeah.
Like, that's just got to be the worst feeling. And she's like, my last vet said he wouldn't make it a month. And here I am a year later. you know, and fair. Like I always tell people, I wish vets wouldn't say like you won't, you know, I mean, I always say, you know, I can't really tell you because like we don't yada yada yada. The
Hmm.
textbook would say this, but you know, things change. Like, you know,
Right.
there's the reason we call it a mean survival time. It's an average.
Right.
And she's like, I prayed to get him this far. And I was like, if you really believe that your prayers helped, your prayers sent you to me. Like, you know, I'm here to help your pet and their suffering. And she like just left and was all mad. And I got an email the next morning telling me that he died. And that's the hardest part because
Yeah.
like euthanasia sucks. Like it is absolutely awful.
Yeah.
Every time it kills a part of me with it, right? Like and because people um again, because I'm in general wellness, like
Hmm.
I've known a lot of these dogs now. I'm starting to put dogs down that I've known since they were puppies.
Wow.
So, like, if you've been coming to me for the greater part of a decade, now, you know, I've seen your dog every year, you know, I've grown up with them or they've grown up with me. And now, like, you know, I'm putting down someone who's my friend too.
Yeah.
Like, but at the same time, like you can make a lot of really, really great clients through that. Um, with euthanasia, I can, you know, I can be their first step towards healing.
Yeah.
And I really can make a difference. And so like that is the part of the job where I do feel like I can make the most difference. Like if you do a really good job at your euthanasias,
Hmm.
you have made that person's day a little that person's worst day a little easier.
Right.
And that's awesome.
So
Like,
what would you say like being good at euthanasia is more of like being able to like help the person
yeah,
like through the process?
yeah, absolutely.
Okay.
Like, I mean, so a lot of you'd be surprised how many times people tell me it's like, oh, I always wanted to be a vet because I just can't stand people. And it's like we are a people job
Hmm.
more than we are an animal job. Like, you know,
Yeah.
it's all communication with owners.
Hmm.
And so like, I mean, I've had I had one client get a little too gropey.
Oh wow.
Yeah, actually after euthanasia and this my assistant went in the room and she's comes out and she's like, um am I going to see that good looking doctor that's on the internet? And she tells her he's not that good looking. And I go in the room, I talk to her, I'm like, okay, here's our plan. And Marissa was my assistant's name. She goes back in there and um, she goes back in there and the woman goes to her, you're right, he's not that good looking. And well, unfortunately, the dog was like really sick and we ended up euthanizing and she's crying and I'm like, do you need a hug? And I give her a hug and she got way too handsy. And I left the room and I'm talking to Marissa and I'm like, for someone who's not that good looking, she did definitely take some liberties.
Right.
Anyway, but like, I mean, as far as that stuff goes, like yeah, like if I can help someone through their worst day, like that's
Yeah.
awesome, right? Like
Yeah.
there's just as much reward in that. And like I said, a lot of times I'm putting down pets that I'm really close to.
Yeah.
Um and you know, I love all my patients, but you know, I'm getting to that point into my career where I'm starting to like have, you know, starting to put some of them down that I've known the entire time.
Yeah.
But you'd be surprised how many times people come back and they're just like you just made this so much better for me. And
Right.
um and that's just, I mean, it's incredible. It's a really incredible feeling sometimes.
Yeah. I mean, it's kind of I kind of love that you say it that way because personally I couldn't imagine being in that position. Like I have three dogs myself,
Yeah.
and every time I scroll on Instagram or TikTok, there's a freaking video and it makes me cry every time because I just look at him laying in the bed and I'm like, one day that spot's not going to be full anymore, and
Yeah.
it just kind of really like I honestly think about it way too much to the point where like it's like almost
Oh, you're
daily.
telling me.
Like, yeah, I'm
Like,
sure you like shoot.
one of my dogs is a medical nightmare,
Wow.
and like she's on 7 different meds daily,
Jeez.
just to keep her going.
How
But
old is she?
she's gonna be 9.
Okay.
But she's like the absolute love of my life, right? Like her full name is Super Mutant Alien Baby. She's a French bulldog.
Nice.
And she goes by Mutie for short, but like she has epilepsy, so she seizes. And like I've told people before, like one day she's gonna be gone and my life will be infinitely easier, but significantly emptier.
Yeah.
And it's, like she, because she has epilepsy, her meds are timed, so I have to get up at a certain time every morning. And I have to be home at a certain time every night. She comes
Mhm.
to work with me every day. So like when I take vacation, she stays with someone who has, medical training, like,
Wow.
um, because like they need to be able to give an IV injection if she seizes.
Jeez. Has she
And so
always had that problem? Or is
no,
it
they
like,
started sometime around 4, which is
oh,
pretty
wow.
normal.
So it's been 5 years though of that now.
Yeah, of
Wow.
really like controlling my life, but also like I mean even like stupid shit, like some of the meds she's on just make her
Hmm.
pee more often.
Right.
So like sometimes she'll have an accident in the house and it's because she just can't hold her bladder anymore and I
Yeah.
wasn't right there for her.
Yeah.
Like, and I mean like that's fine. I chose this.
Yeah.
Like, but like it's stuff like that, like, people don't really think about it,
Yeah.
how much, in my life is different because, I have this 13-pound bug-eyed butthole. um but like I mean, like I'll be gaming and she'll just like sleep in the crook of my knee,
No.
and like it's, like at that time, like I'm like I think that's her happy place, but I think I'm happiest like just right
Yeah.
there.
Yeah.
Like, yeah. So I mean even like when I drive, like when I'm driving places, like a lot of times she'll try and crawl in my lap because she wants to be in my lap. And but
Yeah.
she, I travel a lot. I've been all over the place. Like, and so we go on road trips together. And Dude, my golden doodle, can stay places, but Mutie is
Yeah.
always with me. Like, so she's for 5 years now. Like
Yeah.
maybe like, when I've left town, like I'm going to a wedding this weekend and I have to drop her off at one of my tech friends' homes and she's going to take care of her. And
Yeah.
like, that's the longest she'll have been without me for a while. Like, so it's just, like
I
that.
mean, I bet that's nice though that, obviously you're a vet too, so you can take
Mhm.
care of her, but I'm sure it's nice that all these other,
Yeah,
techs
it
that
is.
can do that too. And like all my dogs are young, right now my
Uh-huh.
oldest is 4. And I got her, 2020, like I want to say February. So it was like right before COVID. So it was like the perfect time to get a puppy,
Yeah, absolutely.
and she's a great dog and everything. But I have 3 levels of dog. Like I have a very small one, a medium size, and a very large one. And the very large one is who I have those like worries for with the medical stuff
Yeah.
because he's a Staffordshire Terrier and he's about
Mhm.
90 pounds. And so I'm worried about the hip issues, I'm worried about the legs and all these different things.
Yeah.
And, they're still relatively young, so I won't have to worry about that for a while. But, hearing you talk about it just makes me think about it more of like,
Yeah.
it really is going to be a struggle once he gets to the point where, I mean, hope and pray that never happens. But, with those breeds, I mean, you know how it is.
Yeah. And I mean, so Staffy's your big orthopedic issue is probably going to be a blown ACL.
Hmm.
Um, but like keep him in good shape,
Hmm.
keep weight off of him. And like if he does, if that does happen, then there's different ways to treat it.
Yeah.
Like, so it's just one of those things. Always make sure that you have like an emergency fund for your dogs.
Yeah.
Um,
That's the biggest thing I've had to come to the realization of as a dog owner is like
yeah,
you think about it, oh, it costs this much per month with food and blah 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 vets. And actually I have a question about vets in a second.
yeah,
But you think about it like, oh, it's X amount of money, that's all it's going to be. And it's like, well, they're a creature just like anything else. They get injured, they get sick,
yeah.
stuff happens. Like my dog, my first dog, she got Lyme disease like
No,
within the first like year and a half of having her. And luckily, we caught it early enough. It was pretty much, right as it happened. So we were just able to, treat it and move on. But
mhm,
that kind of made me wake up and realize that like, man, anything could happen. It's
yeah,
just we were just on a walk, a tick fell on her, it had Lyme disease, and
yeah.
that's just how it happened. So it just kind of like something that like I said, you don't really think about necessarily at the beginning, but it definitely happens.
Well, and do you have them all on flea and tick prevention?
I do now. Well,
Yeah.
actually, she was on it at the time. My dumbass just forgot to give it to her.
Oh,
Um,
fun.
so yeah, it was pretty great. I paid the $30 for the pill and then I forgot to give it to her and she got Lyme disease.
Perfect.
So it was, yeah, great job on my part.
Yeah, I mean,
But
shit happens.
yeah.
But like that's a good I mean, I'll forget to give my dogs prevention
Hmm.
um every now and again. And that's certainly that's happens to all of us. I don't have that luxury with muties everyday meds. Like I
Right.
have to give them at a specific time every
Yeah.
day.
Which I'm
Um,
sure, helps you, stay up on it and everything. If you
yeah,
have an alarm going off to tell you, it's
yeah,
like, I better do that. Like,
no,
um,
absolutely.
but the question I was going to ask is, I feel like I'm already going to know your answer on this one, but I just want to hear how, like, what it's going to be.
Mhm.
So how do you feel about like the like mobile vet clinics, the like cheap, like, tractor supply type of things?
So they have their place, and they do a good service.
Hmm.
Uh, they're not that much cheaper.
Yeah.
Like so I actually work for Petco right now. I'm a corporate vet.
Okay.
So Petco has Vetco Mobile and Vetco Total Care. So I'm in a total care, but they have their mobile clinics that go around.
Hmm.
My vaccines are actually cheaper than our
Really?
mobile clinic. Yeah. Like the difference is you pay an exam fee for me. Um Generally speaking, so that might make it, I think my exam fee is like $70.
Hmm.
So that's really where the savings is
Yeah.
in like not paying for my time. Um, but like when you go, the problem with the mobile clinics is that you're not getting a thorough work.
Right.
Because like I do tell people the most important thing that happens uh in your general visit is my physical exam, because you'd be
Yeah.
surprised how many things I find wrong with your pet,
Hmm.
right? Like, and because that's why you're coming.
Yeah.
It's because my job is not just to vaccinate your dog, like, but ear infections, skin infections,
Hmm.
dental disease, things that I can do that will help your dog live a longer life. Like people don't really realize how
Right.
important dentistry is.
Yeah.
Um, but like it actually dentistry actually like good dentition can prevent heart disease.
Yeah.
So like, and people don't really realize that, but I mean, there's a vein right here that dumps its blood supply right into your heart and
Hmm.
brings all the bacteria from your mouth with it. That's why they tell you to get your teeth cleaned twice a year
Yeah.
by a dentist.
That's true.
So I mean, there's important stuff like that,
Hmm.
but even just things that I can do on the norm to just make your dogs every day more comfortable.
Yeah.
And you know, like we can talk about losing weight with your pet, or we can talk about, oh, you know what, like I think you're starting to get some arthritis. Let's start some joint supplementation, or like, and that's something you might, you know, want to think about for your bigger dog. You're like, you know, when we start to get to our 6, 7, 8 years range,
Right.
you know, 4 isn't old, but you know, 7 years old is considered a senior pet for a large dog.
Yeah.
So he's getting to that age where, you know, you might start to see some grinding in those joints, especially if he's been an active boy. I'm only in my 40s, and
Right.
I talked to my doctor this morning about one of my knees because I'm like, something's wrong with this, man. And
Right.
he was like, we're going to refer you to an orthopedist. And like, you know, but I'm essentially a 4-year-old dog, right?
Yeah, that's true.
Like, so like, you know, dogs age 7 times faster than us.
Yeah.
So like if you go 2 years without a thorough workup, it's like you're not going to a doctor for 14 years.
Yeah.
So they're a good service. The real problem is more often than not, they're really not that much cheaper.
Yeah.
And you don't get what I would consider the most important part.
You know, and I would agree completely, because that's what I use with my 3 dogs. I go
Uh-huh.
to Vet IQ or Vet Co or whatever it is. I can't remember.
It's Vet IQ, I think, is in your area. I don't
Okay,
know if there's a mobile Vetco mobile out there.
gotcha. But I just, with my first dog, when I first got her, I took her to, I had a vet. We had like a specific person we went
Mhm.
to. It was like, you know, how it should be. And that was great, but I will say, I think it was just the vet I was going to was way too expensive. Like it was insane. It was like $150 to be seen. Like it
Oh
was
wow!
wild.
Like
Yeah.
just your exam fee?
Yeah. And then so every single time I went in there, I was spending $300 because you know it's
Jesus Christ!
$30 for the flea and tick, and then 150 for
Yeah,
the exam, and then I'd get her nails trimmed and whatever else. So it all adds up, you
absolutely.
know.
No,
And
and
so
that's
yeah, and so I stopped going there, and then I got a second puppy, you know, and I was like,
Mhm.
well, I have to find somewhere to bring my puppy. That's when I found the Vet IQ, and it's worked out well for that specific thing. But the
Mhm.
thing that I've really been looking into getting a vet again, like a
Mhm.
specific vet, because it's been about a year, you know, since, or a year and a half maybe, since I had a real legit vet, and I just feel like they don't weigh them even, like they're not
Yeah.
checking anything. Like I go in there, they're like here, and then they're like, go out, see ya.
Mhm.
You know, so it just feels very impersonal. You know, the worst part is you got to sit in a Tractor Supply with your dogs, you know, as they're like barking at
Yeah.
each other and going crazy, you know, and I've just come to I'm glad you said it the way you did, because I agree completely. Like I just feel like the Lyme disease, even that issue, they
Yeah.
would have never found that. You know, they wouldn't have
No,
ran those
absolutely.
tests. So that makes me just want to go back to a regular vet even
Well,
more.
and I mean, like you said, you got it for your puppy. And I will say, like, you know, a lot of times, um, with my puppy exams, I try to not charge my exam fee.
Hmm.
Cause like, okay, first exam, you come in, you get established. Okay, perfectly fine. Those are long exams,
Yeah.
but you know, it's every 3 to 4 weeks till they're 16 weeks old. Sometimes you're coming in there 4 or 5 times.
Yeah.
Like I try to, you know, so if you're going to, you know, the Vet IQ or the Vetco mobiles for that, like perfectly understand, because
Yeah.
you like that. I don't always feel that that exam fee is warranted.
Right.
Again, I don't really have much control over it because I'm a corporate vet.
Yeah.
So like my corporate dictates what I have to charge and when. I have some wiggle room, but I have to be able to justify everything.
Yeah.
There are times I'll be like, okay, if we're just going to do, you know, your last distemper, we can do that with a technician, and then you don't have to pay a
Okay.
doctor's fee. Or, you know, you come in, if you were to come in and see me and you'd be like, hey, like, I don't have any questions. We're just doing, you know, my lepto booster with the Lyme, and you've been seeing in the last year. Yeah, I'll try and make those things cheaper. I tell people I'm a cheap vet. Uh,
Right. It's always good to
because
hear.
yeah, I mean, like I don't have control over what hospitals charge.
Right.
Like, I've never owned my own hospital, which strangely was my goal when I started this. And like I swore at one point I'd never work corporate, and now I work corporate. And I'm like, why do I want to own my own hospital?
Right.
Like it seems like a lot more work.
Yeah. Oh
Um,
yeah.
but like so I don't have, but there's always something I can do to make your visit cheaper.
Yeah.
Like there's always some way for me to figure it out. And I mean that's something we have to do in vet med, right?
Mhm.
Because I mean I'm not someone that charges $150 for my exam fee,
Right.
which is
Right.
insane.
Yeah. It was it.
Like
The only reason I even went to that vet was because my cousin, who I was a roommate with at the time, his
uh,
mom always took their dogs there. And he was like, "Oh, they're really reputable. They're really good." And I didn't know what regular charge was, you know. And
and it varies. Like I said, I think my exam fee is like $70.
yeah.
Which, like, I mean, I'm $408,000 in student loan debt. Like that's
Yeah.
what my education cost me. It's
Right.
it's
Jeez.
it's uh you're paying for the time to talk to me and
Yeah.
whatnot, and
Which, and that's
so
totally
it's
understandable, you know,
yeah.
because that is a lot more valuable than the mobile vet where you're just going there, you're getting a shot and you're getting out, you know. And $70, I feel like you said, especially if you've got a bunch of questions or there's something wrong with them, it's well
Yeah.
worth it, you know, to find out what's going on at the end of the
Well,
day.
and I like to take my time in rooms too, like
Yeah.
especially if there's a fearful dog, I can take my time, let them warm up to me.
Hmm.
Or again, like, with puppies and everything, if I can make your dog like the vet, all the better.
Right.
So like I'll spend a lot of time with puppies, just feeding them and playing with them and whatnot. I mean, so, a lot of my patients like to come
Yeah.
to the vet, and it's, people will come with me and be like, my dog loves it here. Like, what dog loves the vet? And I was like,
Right.
like my staff, me, we work really, really hard for that.
Yeah.
And and not every vet does that, but I've worked relief clinics before.
Hmm.
And there's some of those dogs wouldn't be getting care at all.
Right.
And so some care is better than none.
Yeah.
And like there's a lot of it's like elderly people. And this one guy came in one time and he had two Yorkies. And I was like, you really need to get those teeth cleaned. And he was like, how much my vet wanted to clean those teeth? And I was like, no. Like he's like $500 a piece. And I was like, that's because he's probably gonna be pulling all of those teeth. Like that's a
Damn.
deal. Cause like I probably would charge you like 1,500 to 2 grand.
Damn.
I mean, people don't realize when, like, we're not just cleaning teeth. Like
Yeah.
what we do with dentistry is more akin to dental surgery, right?
Right.
So it'd be more like you going to get your wisdom teeth pulled. Like
Hmm.
a lot of times I'm cutting bone and like exposing
Jeez.
roots, and
Hmm.
there's a lot of broken teeth because dogs will
Yeah.
break their own teeth because they chew too hard, because dogs love to be idiots.
Right. Dumb
Uh,
as fuck.
but and cats actually can get an autoimmune disorder that attacks their teeth and reabsorbs them,
Oh wow.
and that's super painful. So those teeth need to come out.
Yeah.
So like a lot, like I said, a lot of times you're doing what's more akin to dental surgery rather than
Yeah.
just like your dental cleaning,
Right.
right?
See, and
Um,
the thing that I really like that, you know, I wish you lived close to me because I'd have you be my vet because you're not just like a nice guy. You can tell that you really like enjoy it and love the animals, you know. I feel like the big reason why, the price aside, the big reason why I stopped going to that vet or just a vet in general is that it just felt very impersonal. You know, like
yeah.
they were very like short and sweet. They wanted me out of the room. It was like, sorry, see ya. We'll figure it out. We'll see you in 15 minutes. It was never like I never knew their first name, like
Oh,
nothing.
really?
It was really odd. Like they wouldn't even let me in the room while they were clipping her nails, like stuff like that.
Oh, well, was this during COVID?
Yeah, actually, now that I think about it,
Because
it
that
was.
might be more what it was.
Yeah,
Because I
that's
mean,
probably what it was.
there was a lot of times during COVID we were like, people were staying in parking lots, and
Yeah.
Like, so that might be different now, but still 100. I mean, I don't know what his overhead looks like. He's probably a guy who sees 8 appointments a day.
Hmm.
Like I see somewhere like 16 to 25
Damn.
appointments per day. And
Hmm.
like that's why I can charge less.
Yeah, I guess that makes
Because
sense.
like but he's probably seen 8 appointments. He probably does really take his time. I also take my time.
Yeah.
He probably really takes his time and sets aside an hour for every appointment and just does. And if you're going to do that, you have to charge more.
Yeah. See, and
Um,
that's the thing about it though, is that we were always in and out 15, 20 minutes.
really?
Always. Like it was
Yeah.
like, and I don't know if I ever even met the actual vet. I think I just met like so I don't know how this works. Is there nurses and then doctors still, or is it like everybody's a doctor?
No, so there's technicians and assistants. There
Okay.
there is like a movement to get it to veterinary nurse rather
Mhm.
than veterinary technician because but like human nurses for some reason are offended by it and don't want it to happen. It's kind of like it all sounds shitty, but like
Yeah.
whatever. I
Yeah.
do think in like the UK, they're called veterinary nurses, but in the States, for the most part, every state that I've worked in is still tech, whether
Gotcha.
it's licensed, certified, or registered.
Right. Yeah.
Um,
Yeah. That makes sense. And
but to be fair, like if you were to go to your human doctor, you spend most of your time talking to the nurse.
yeah.
Human doctor comes in, he's like, okay, like they told me this, they told me this, and they told me this, and okay, here's what we're gonna do.
Yeah.
But they're um God, how did that person phrase it? Like if I can do something in 10 minutes and I charge you $100, you're not paying for that 10 minutes. You're
Hmm.
paying for the 10 years it took me to get good enough to do that in 10 minutes.
Yeah.
And that's what it boils down to. And I'm sure, like I know you said when you were doing odd jobs, I remember you like doing some painting
Hmm.
and stuff and talking about that on Twitter. But like that's a skill. Like
It's the same thing. I mean, people say the
yeah,
same thing in trades and stuff. It's like, yeah,
absolutely.
I see this post go viral all the time where it's like, this guy told me I'm charging him too much. And then I went and showed him how much every tool costs and how
Yeah.
much everything costs. And then he's like, oh, because he was like, do it yourself. And then he's like, well, I need all these tools. He's like, exactly. You see why,
Yeah,
so,
exactly.
and it's a little different because there's not so much education that goes into trades, but there's a
Yeah.
lot of equipment and things that you have to pay for yourself. And that's really why I got out of that business because
Yeah.
I'm not cut for it really. I don't think I'm not good enough with people to like when relationships are going rough, I'm not very good at mending them, you know?
Yeah.
Like I'll just tell you to go fuck yourself and that's just what it's gonna be because there's just some personalities out there that you know how it is. You
Yeah,
just
yeah.
can't I
Oh
can't
yeah, I'm
do it.
sure.
I can't even
We get
do
them
it.
in vet med too.
Oh yeah, it's the same
Um,
people.
but yeah, probably. But like, I mean, like, I think the guy who painted my upstairs charged me like $1,500 and he installed ceiling fans.
Mm,
But like, $1,500, it took him and the dude that came in, he painted the entire top floor and installed ceiling fans. Took him maybe 2 hours. And
damn.
like, if I had tried to do it on my own, it would have taken me a couple days, right?
Damn,
Because
two
like,
hours.
yeah, I mean, he just came in like he did it all. Well, probably total time 2 hours because he did it in 2 days, like because he did the
Oh, I
first
see.
coat and then came back the next day.
Gotcha.
But yeah, like it would have taken me multiple days to do
Yeah.
it. I would have had to have made multiple trips to Home
Mhm.
Depot. And during that time, like when because I was selling my house, I was doing a lot of relief work.
Yeah.
And so I was making money while they were doing that because I was out of the house letting them paint and making money. So I would not only did I um waste the time painting,
Hmm.
I lost the money I would have made working
And then you would have had to
and
pay for it
pay
anyway.
for it anyway. So
Yeah.
it's like it's kind of like double dipping
Yeah.
but in reverse, it's taking, multiple sources away. Yeah. Anyway.
Yeah. No, I
Like,
totally get what you're saying. All right. So now let's get into the nitty gritty. Okay.
okay.
This is the question that I've been waiting to ask this whole time. What has been your favorite moment as a veterinarian?
So, okay. This this is kind of like kind of an accident. But I mean, like, some of our greatest things happen by accident, right?
Mhm.
Like the woman who invented those stupid fucking things you put in Crocs
Oh yeah.
happened, like, she happened to meet the guy who the CEO of Crocs at a pool, and he saw her daughter with those stupid fucking, now she's a millionaire.
Wow. Talk about
Yeah.
luck.
Yeah, I mean, like, lucky things happen, right?
Right.
So there's a condition in cats called FIP,
Mhm.
um, which stands for feline infectious peritonitis. Peritonitis is your abdomen is also called your peritoneum. Anything with itis is inflammation. Basically, there's variations on this disease, somewhere between 2 and 4. Either way, up until recently, it was 100% fatal.
Wow.
So, like, basically your kittens will get it. It's really hard to diagnose. I had a client come in, um, and oh, I have two stories. Sorry, I have to tell both stories.
Beautiful.
Uh, had a client come in, and she's like, my cat's struggling to breathe. I found fluid in its abdomen and in its lungs, because it can kind of vary. And I was like, I think this is FIP, and, like, I'm pretty sure. I happened to read an article the weekend before.
Mm.
Um, that owner read that same article.
Oh wow.
Um, and it was about a drug that you couldn't get, because it was not labeled in the States yet. Um, a drug that you could get that would cure it. And I was like, there's a treatment out there. I just don't know how to get it. Well,
Mhm.
she did a bunch of research and figured out how to get it. So she's importing this shit from the Chinese black market.
Wow.
Um, and, like, she's asked me, she's like, will you go on this journey with me? And I'm like, I will support you in whatever way that doesn't put my license at stake.
Right.
Because, we're using illegal drugs. Like, that is not okay.
Right.
Like, I can't, and there's, like, I couldn't do injections for her, or
Mhm.
I will never recommend the treatment to anyone. Well, that cat's alive. Like, the cat's still alive.
Wow.
I was one of the first veterinarians in the state of Indiana to cure FIP. Cure. I, like, I say this like it's cool, but, like, I've already said, the owner did most of the heavy lifting.
Right.
But, like, there was a time period when I was working in northern Indiana where FIP cats were coming to me
Mhm.
from all over the area, because they were like, Dr. Morton's done this before, so go to him. And every other vet was still in the mentality of, put them down. Um, and I was just like, okay, no, like, we can figure this out. And so I kind of became a referral vet.
Mhm.
Well, that same owner, um, was got all my data and everything involved in a study that was actually funded by Newt Gingrich's wife, because her cat died from FIP.
Oh, okay.
Anyway, so I went to a conference later that year, and there was an FIP lecture, and the study that I was involved with got presented to me. And I mean, like, we talked about imposter syndrome earlier, right?
Right.
Like, who the fuck am I, right?
Right. I
And,
hear
like,
that.
I go to a conference, and, like, I'm not board certified in anything. I don't do research. I go to a conference, and I go to a topic that I'm interested in, because I wanted to make sure that I was doing this shit right.
Right.
And so I go there, and I start texting Melissa, who's the client that, we fixed her cat. And I'm like, do you recognize this? And she's like, you bet your ass. Or I'm like, I'm watching them present this to me. Like, it was so fun and just really cool.
Yeah,
That drug recently just got announced that it's going to be legal in the States. So
that's
we're going
great.
to be able to help a lot more cats. That is not because of me, but veterinarians like me who have been using it and pushing to get it labeled for this and made okay for us to use. And you know, I am a small part of that, and I am incredibly proud of that
Yeah.
because over the last couple of years, maybe, well, okay, 4 years, because it was in 2020. Was when because I remember she gave me a bottle of whiskey as a thank you when we fixed it, and I had to go out to her car because she couldn't come into the hospital.
Oh yeah.
But so for the last 4 years, like, you know, I've personally probably saved dozens of cats.
Wow.
And then, you know, veterinarians like me have saved hundreds more, and we now can get it, you know, cheaper, easier, and not put our license at risk by recommending it. And that's just like, you know, like I said, I'm part of that, and I'm incredibly proud of that. Even though I'm a very, very small part.
I mean,
Um,
you did your part, you know, at the end of
yeah,
the day.
and and like I said, you know, if I was like an ophthalmologist and had done a study on eyeballs, and you know, someone was presenting it to me at a conference, I'd be like, oh yeah, like that's part of my job is to do research. Like, I don't do research. Like, and I
Right.
got involved in a study and it got presented to me just because like it was just cool.
Yeah, that is
Like
pretty sweet.
then 2020 again. I was getting uh really upset at this job that I had. I was on procedures that day, and well, okay, so I used to work at the emergency room in South Bend,
Okay.
and they had seen a dog there, and that I don't believe that owner had a GP that they could take them to because you couldn't keep them there during the day. So
Right.
it's Monday morning. I'm on procedures. I'm supposed to not take any like emergency cases. Well, I'm sitting in the doctor's office and I hear this woman up front, and um I can hear like my dog's struggling to breathe. I was told to come here. Receptionist comes back, and she's like, hey, like there's this lady here. She's not a client, but it's an emergency. Will someone take it? And the entire doctor's office is just quiet.
Yeah.
And like we were all getting burned
hmm
out. Anyway, because COVID was hard on veterinarians. Like
Yeah.
I got upset and I like threw my keyboard dramatically and just was like, get Annika. Annika was my technician. I was like, get Annika, tell her to get the dog and get it on oxygen and we'll take care of it later. And then Annika is this tiny little blonde girl. Like she can't be over 5 foot,
Wow.
but like just as heated as I am.
hmm
And so she comes up to me and she's like, you're not supposed to be doing this. Like you're on procedures. And if it wasn't a bulldog, because I love bulldogs. I love
Yeah.
anything with a smushed face. If it wasn't a bulldog, you know you would have kicked it out of the room. And I was like, no one else is gonna take it. Like we're just screaming at each other in the
Yeah.
lobby. Like no one else is gonna take it. So like either we take it or the dog dies. What do you want? Pick. Like and she's like, damn it, Morton. And she like stomps off, gets the dog, takes it in back, and like the owner is probably like, what the hell is going
Right.
on? That was a really, really difficult case. We ended up fixing it, like,
Right.
but we had to get like very MacGyver-y medicine. So like we actually made an oxygen cage for him at home with like a regular kennel, saran wrap, and an oxygen generator, and they could take him home. And then like she sent me a video of him just playing outside of oxygen for like 10 minutes, and this was
Mm.
after like weeks of oxygen therapy. He just had something that was really resistant in his lungs, and it just needed a lot of antibiotics, and we got it eventually. It just took a really, really long time. Well, that owner is involved. I'm a huge horror movie nerd.
Hmm.
And like my favorite movie is Jaws.
Okay.
Well, that owner was involved with a conference called Days of the Dead.
Mm.
Well, she's like, come to Indianapolis, this place, this date. Like, go there. And there's this big horror movie conference going on. Well, she got me in, and like just takes me through the entire conference. And so like Susan Blacklenny is there, who she just passed last week,
Mm.
but that's Chrissy Watkins, the first victim in Jaws.
Oh yeah.
And she's
Actually,
like,
oh sorry, go ahead.
no, go ahead. No.
I just watched a video the other day about Jaws, and
Uh-huh.
apparently in the scene, the beginning scene where she's getting jostled around, she actually broke multiple ribs
Yeah.
during that. Did you know that?
Yeah. She
Okay.
told me all about it.
Oh, okay,
Like,
gotcha.
well, because she brought him up to me and she's like, oh, you're Debo's vet. So the dog
Mm,
was named Debo. And like all of these people knew Debo. And so they're like, oh, you're the vet that saved Debo.
mm,
So they're taking me through this conference. Susan Blacklenny tells me, she's like, oh, like you're Debo's vet. And she talks
right,
my ear off. Then she starts telling me her story. And she, like, because she's like this tiny woman.
right.
Like she's like maybe 4'9", but she's an older woman, and she's telling me about getting cast for Jaws, and she's like, well, I was an animal trainer. Um, I
Mm.
was an I was an animal trainer, I was a stunt woman, and I was willing to take off my top. Uh, and
Sounds about
it
right.
was just the funniest thing. And she's like, they saved money and they knew I'd take my top off. And I was like, oh, okay. But like I was in line to go see Tony Todd,
Mhm.
and uh I was like, hey, do you have or do you take credit? Because I didn't bring cash because I
Yeah.
never carry cash. And Tony Todd's agent's like, it's cash only, sorry. And one of the owners comes up to him and he goes, that's my vet. And Tony Todd's agent goes, you're Debo's vet. Like everything's on the house.
That's
And
awesome.
like, so I got a picture with Tony Todd and an autograph for free. Like he was like, take anything you want and we'll sign it. Like, we appreciate it. And then I got to meet God, I forget. He's the original Michael Myers,
Oh,
but
okay.
there's like 5 people that played Michael Myers in the movie.
Hmm.
He's specifically only Michael Myers. His name's Tony. I can't remember his last name.
Yeah.
Um, Someone gave him a bottle of tequila, and he was like, oh, do a shot of tequila with me. So like I'm doing a shot of tequila in the middle of this floor with
Wow.
the original Michael Myers. It was just a ton of fun.
That sounds
Anyway,
awesome.
I met Richard Dreyfuss, and
Hmm.
I have a t-shirt on that says pause with a French bulldog attacking a piece of pizza. Um,
That's
Great
great.
shirt. And
Yeah.
Richard Dreyfuss's wife is like, do you have a French bulldog? And I'm like, yeah. And she's like, we have a French bulldog. And then like I start talking to his wife about our French bulldogs. I get to see all about Baxter Dreyfuss. And then Richard Dreyfuss is like, oh, you're a vet? And he's like, do you have a card? And I'm like, no, I don't. I don't have a card on me. And he's like, I was like, here, like just wrote my number down on a piece of paper.
Hmm.
So Richard Dreyfuss has my phone number. Uh,
Pretty cool. Pretty cool.
he's never once called me,
Yeah,
but
but
it was still kind of cool. And like
yeah,
he took a picture with me too, and it was just good times.
that's
And
awesome.
it's like I said, like I had no intention of anything like this happening, but like those owners were so appreciative and so wonderful,
Hmm.
and they just like I can never go to a conference again because I'd have to like feel like a normal person.
Right.
I felt like a celebrity going to
Right.
a conference talking to celebrities. Like
Right.
I mean, don't get me wrong, like Tony Todd, I don't even know if you know who that is. That's the original Candyman.
Mm,
And like guy's enormous, and like
yeah.
he's maybe a B movie actor, but like he's someone that like I've seen all of his movies,
Right.
right? And like there was a guy in front of me in line when I was waiting for him had a paper mache head of Tony Todd that he wanted him to sign because he had like it was like a collectible thing that got made that he
Right.
had. And I'm like, this guy is sitting here and he's like, yeah, you can have whatever you want because I know this dog that you saved.
Right.
And people like have plaster casts of his face that they carry in their home.
Right.
Like, I mean, it was just really cool.
I'm
So
sure it was a
that's
really surreal moment, you know,
it
just like,
was.
wow.
It's one of those things that like I never in a million years thought that like I would be talking to Richard Dreyfuss about a patient
Right.
because he knew the dog.
Right.
And like yeah, it was just a really interesting time.
That's
Yeah,
awesome.
anyway, that's that.
That's a great story. And I honestly like it just kind of shows, you know, the power of certain things you do. You know what I mean? Like if you saved that dog, that then turned into all of this, you know, for you at the
Well,
same time.
and I mean it's not even that it turned into like look at how much that meant to how many people.
Yeah, exactly.
Like, I generally get to talk to maybe two or three people that actually own a
Mhm.
pet. Like, but we don't think about how much pets really touch our lives, even when they're not, our pets. Like,
Mhm.
Debo went to those conferences, all of the people that worked there knew him
Right.
because he would go and walk around the conference with those owners. So they all knew who he was, and he was just an adorable little bulldog puppy. And
Right.
like, everyone was like, oh, he's gonna die. And we fixed him. And it just took a lot of effort and a lot
Yeah.
of time. And like, I mean, maybe if they had gone to another vet, it doesn't happen like that. Just because
Yeah.
like I really did pull out all the stops, call internists, like
Mhm.
I really put my heart and soul into that case. And like that was never I had no idea that these people were in any way gonna like introduce me to people that I like,
Right.
love their films. Um, but like I just put my best foot forward.
Mhm.
And I don't know that every veterinarian does that for this specific dog in this
Right.
because it was a lot of work.
Yeah.
And but like I said, I positively impacted all those people. And if I hadn't gone to this one event, I never would have even known.
Yeah. Yeah, you know, and the thing I love about it, honestly, the most is like you just said, you know, most maybe not, but most likely most vets wouldn't have gone to the lengths that you did, you know, and that just goes again to show that you really love it, you know, and you really
Yeah,
care. And that's what matters in a service or, you know, in an industry like yours where
absolutely.
your healthcare, you know, at the end of the day, if the people don't care, there's
Yeah.
going to be a big disconnect, you know.
Well,
So
and all of us get into vet med for good reasons,
mhm,
but there's a reason it's got a high burnout rate.
yeah,
And it's because it's really hard.
yeah.
And
And I mean,
like,
we're all human at the end of the day, you know.
yeah.
We only can withstand so much before it gets to the point of like, you know,
And even, I'm not saying anything against any vet who would have seen him. Like when I say maybe they don't do that, like, maybe they want to go home and have dinner and see their
right,
family, and they just don't take that extra time
right,
because I really took a lot of extra time for that case
yeah,
and ended up with a very positive experience out of it. It it became something where I was like, I'm not letting this dog die.
yeah,
And like so it became a very big passion project for me. And like,
yeah,
like it was, and the owners knew that.
right.
So like I mean, I literally called them crying when I saw a video of him breathing outside of oxygen because I was like,
Oh,
I mean, so like it was almost as rewarding for me as it was for them.
yeah.
Like, but
Yeah, and I just love that so much personally as a I'm a dog person, but I love all animals. So
uh-huh.
like I like animals more than I like people for the most part, honestly. So it's like, you know, I just love that there's obviously vets get into it for the right reasons for the most part,
Yeah.
but I just love actually hearing that from your mouth. You know what I mean? Of like
Yeah.
from the source, like that's really how you feel. That was going to be my last question, but something
Okay.
you said made me, it's a quick one, but the French Bulldogs, right?
Yep.
You mentioned you love anything with a smushed face.
Yes, absolutely.
Is that kind of a like um not contradictory, but is that kind of like odd being a vet that's in love with dogs with smushed faces when the smushed face dog has medical issues? It's like paradoxical, you know?
Yeah, no, and I do tell people like um French Bulldogs are my absolute favorite breed.
Mhm.
I used to have three.
Wow.
Um, and all of them had problems.
Hmm.
Like and that's how I got them. All my dogs are all my pets in general are medical surrenders.
Okay.
So like they were gonna be put down and I put my own money and time
Wow.
into fixing them. So like the golden doodle, I tell people is more machine than dog because he's got like pins in his hips and stuff
Right.
like that. But he was hit by a car at 8 months
Oh, okay.
old, and the
Damn.
owner couldn't afford anything. And my original intent was to rehome him, and I got him fixed up. And from the very first day he met me, he just I my partner refers to him as my ride or die.
Hmm.
So like um it's common for vets to have conversations about if we were to die, how long would it take our dogs to eat us?
Right.
Because like it's something that happens, and
Yeah.
I figure for the mutant, it would probably be about 15 minutes, 15 20 minutes.
Right.
Dude, it would be a couple days and he would
Yeah.
feel really bad about it.
Right.
But like so anyway, I used to have three French bulldogs and all of them were problematic, but um I haven't purchased any of them from a breeder.
Right.
um so like I don't really like support the industry.
Yeah.
If you bring me your French bulldog, I am very good at handling specific French bulldog problems.
Hmm.
Every vet is, because like skin issues,
Right.
epilepsy, like we all kind of handle those things.
Hmm.
um that being said, uh like if yeah, get a dog, get a problem. Like,
Yeah, that's
right?
valid. That's
Like if
valid.
you're gonna own pets, like you have to remember that you're gonna have problems. I
Hmm.
Like I said, I've never paid for my French bulldog, so I'm not supporting the industry, but like she is the absolute love of my life.
Right.
So I actually think if you look at my Zoom picture, I think it's her in a towel.
That's awesome.
Uh,
That's
she
perfect.
she hates baths. Speaking of which, she's gonna have
Mm.
to get a bath soon.
Yeah, I got to give all three of mine baths like
Yeah.
ASAP. And the only reason I haven't yet is because we moved into a new house and we don't have the detachable
Oh yeah, shower
shower head
head.
yet. So it's like I
Yeah.
just that's going to be a pain in the ass to do it without that thing.
Oh yeah.
So damn, there was something I was going to say, but I can't remember what it was. Um, oh, how many pets do you have? Because you mentioned pets, not just dogs.
So I currently only have two dogs.
Okay.
In my lifetime, I've owned a crested gecko, three
Okay.
rats. Um, During my divorce that I went through a few years ago, I had six dogs, and the pet got
Mm,
split up into threes.
I see.
Yeah, like so I used to have six dogs. Had a cat.
Wow.
Yeah, six dogs at one time, man.
Wow.
Like, do you have any idea? It's ridiculous.
I have three. I couldn't imagine having four. Like
Yeah.
it's
Well, and
insane.
like so my first two were Dexter, who was a puggle, so small, and the
Hmm.
mutant. And then like Dude was third, so he's the golden
Gotcha.
doodle that I still have. And then the next one was another French bulldog who was like 18 pounds, so another small dog. Her name
Hmm.
was Hot Pocket. And going from two dogs to three because the one dog was so much bigger, seemed
Yeah.
like a lot more work than going from 3 to 4.
Yeah.
Because the one, and even though like Hot Pocket was a mess, like we had to express her bladder
Wow.
because she had a bad back, so she didn't have full bladder control. She's
Mm,
a little bit urinary incontinent, but
gotcha.
um, so yeah, I feel like bigger dogs just seem like a lot more work
Yeah.
in a pack situation,
Yeah.
and they take up more space and
Yeah.
like,
And they
but
eat more, they poop more,
yeah, they
they,
poop more,
and
more to clean up. Even
so
though like my smaller dogs are way more work than Dude.
oh
Dude
yeah.
is the easiest going thing in the world.
Hmm.
Like if you just pet him on occasion, he's the happiest thing in the world.
Yeah.
So yeah.
It's kind of funny that you say going from 3 or going from 2 to 3 is a lot harder than 3 to 4 because we were gonna get a fourth dog.
Uh-huh.
Because our long story short, our second puppy we got for free because my girlfriend's parents' dog had puppies and we just took one. And then their our dog's sister had puppies just
Uh-huh.
last year. And we had one picked out and everything, but I was just like, I can't do it. I was like, I don't think we
No.
can do it financially. I don't think we can do it time, like anything. So as hard as it was, we held back from getting a fourth dog.
And remember, my vaccines are cheaper, not free, but cheaper because I do get my like
Right,
professional discount and
right.
everything. So like
Well, and just
it's
knowing more is 100% gonna
yeah,
save you money anyway, because I cost money when it doesn't need to be. Like I'll be all
yeah.
freaking out about nothing. So it definitely does help.
But like, I mean, so owning 6 dogs is a cheaper experience for me, even though like I
Yeah,
mean, uh I remember one of my first clients out of vet school was this old man, and he was like, "Oh, in 8 years, I'm done paying for vet bills." I'm like, "Oh, why is that?" And he's like, "My grandson's going to vet school." I'm like, "Oh, like I'm gonna recommend he try to go to Purdue because I was practicing in Indiana,
right.
um, to stay in state and get in-state tuition." He's like, "Oh, there's a cat outside my house. I don't own a cat."
Huh.
Uh,
That's always fun.
and he's like, "Oh, he won't have student loan debt." And I'm like, "Oh, really?" And he's like, "Yeah, his parents make a lot of money. His dad makes like 70,000 a year, and his mom's a nurse. It's like together they're bringing in like 150,000." I'm like, "You have no idea how much
No
vet
clue.
school costs."
No,
Like,
I had no
um,
idea it was that much until you said it. I was like, holy shit, that's
average vet
crazy.
school student graduates with about 200,000 in student loan debt.
Jeez.
But like if you take away in-state tuition, it doubles.
Oh
So
yeah,
I graduated with about average. So like for an out-of-state student, because I didn't go in state.
right.
But yeah, like my goal would have been to go to MSU, but
Yeah,
I didn't get in there. They waitlisted me.
right. Well, I mean, at that point, what can you do?
Yeah.
But oh, this is what I forgot to mention. Um, so we decided to not get the fourth dog,
Uh-huh.
and I'm kind of mad at myself for not doing it because the puppy that we picked out actually died from parvo
Oh.
pretty soon after they sold her. Um,
Oh
yeah, so
God.
it was pretty rough. Like I was beating myself up about that for a few months. Just like she was the beauty. They're Shiba Inu, Bulldog, Doberman mix. They're like the most uh unique dog I've ever seen. And she was like gray and tan. She kind of looked like a wolf a little bit. And
Uh-huh.
wolves are really why I like dogs so much because growing up I was just obsessed with wolves for some reason.
Yeah, I was
Um,
too.
yeah, it just happens, I guess.
Yeah.
But but I was just so in love with her, and like unfortunately she passed away, and I was like, damn, man, I could have saved that puppy, but you
You
can't save
can't.
them all,
Yeah, you can't.
unfortunately.
That's how you end up with 6 dogs.
Yeah. Oh, I trust me, it's a tough thing for me. I can't walk into a pound because I will not leave without a dog.
Oh no.
It's
I
impossible.
I've left like rescue events crying because I can't take a dog
Oh
home.
yeah.
Like because I'm like, I can't take you home.
No.
Like and I'm I'm not a big crier,
Yeah.
but like every now and again, like especially with animals, like it'll
Hmm.
just kill me.
Yeah. The animals for me, like I always tell my friends this, and not to get too deep because I know we got to cut this short pretty quick. Um, but I didn't have a great upbringing. In my not a lot of love in my house, basically.
Uh-huh.
And so I like dogs so much because that's where I got my love when I was a kid. I've
Yeah,
always had dogs at my dad's, my mom's, my grandparents. It was always a dog somewhere. So it's like that love that you get from them is unconditional, and it is nothing
absolutely.
like anything else on this earth. Like there is not I've never felt that from a human. I've never felt that from like a cat. It's just a dog specifically. They just love you
Yeah.
unconditionally, and that's why I love them so much.
I tell people all the time we don't deserve dogs.
Yeah, nope, we do
Like
not.
there is apps, and I mean, like I said already about Mutie, like there's going to be a day when she dies, and
Hmm.
I'm dreading that day, and I don't know when it's gonna happen.
Yeah.
But with as much as she impacts my life, it will be infinitely easier. Like
Mm.
I can go to a friend's house and stay the night and
Yeah.
not have to worry about like having to be home at 6 a.m. and like,
Hmm.
oh, did Mutie seize overnight and die?
Hmm.
Like all this other stuff. Not I can go to dinner and not worry about her for 15 minutes.
Yeah.
All that aside, as much as easier as my life will be, it will be infinitely more empty.
Yeah, for sure.
Uh, um,
And that's the best way to put it, really, I think,
yeah.
you know. But with that said, I don't have any more questions for you. I appreciate you for coming on, man. This was a great conversation. I know I texted you and I said plan for 45 minutes to an hour. It's been over
Yeah,
2 hours now,
looks
so
like we took 2 hours.
which is fine with me. I didn't have anything else to do, but I
Oh
really
no,
appreciate
thanks.
it, man. It was a great time, and I'd love to do it again if
Yeah,
you're ever free. So once
always
again,
free.
I appreciate it.
Um,
And is there anything that you want to promote, put out to the people while you're here?
yeah, so if you want to catch my own podcast, it's called Vet Med for Idiots by Idiots. You can find it wherever podcasts are podded. Um, it's supposed to be like basically I break down veterinary concepts
Mm,
that we talk about declawing, why we don't do it or why we don't want to do it.
mhm.
We talk about different diseases, but real riveting shit.
Right.
But I mean, we have an episode about bringing a dog into a home or a child into a home with an established dog,
Right.
stuff like that, like stuff just to kind of help people, like stuff that you may not be able to get from your own veterinarian,
Hmm.
and just kind of break it down in a nice easy way. If you
Yeah.
want to follow them or the show on any social media, on Facebook it's VetMed for Idiots by Idiots. On Instagram it's the letter VM, the number four, um, IBI, and we post all of our shows there. If you on Twitter, the only source we have on Twitter is my personal Kent Death Walrus, and all my episode descriptions go up there.
Gotcha.
I also recently um, got put on the board of a new charity.
Okay.
So I've been working with them. It's called Outcats and Underdogs.
Mhm.
You can find them on Facebook and Insta. It's an advocacy group for pets that have bad reputations. So like pit bulls is a big one.
Oh yeah.
But another thing is people don't understand that black cats are the least adopted pet in America, most common to die
Wow.
in shelters because people still associate them with bad luck. So our goal is to help raise awareness of pets that get lost in shelters and help them find good homes. We have our first event in Baltimore. It's at the Metro coming up June 28th, and it's a punk show. So we're
Okay.
raising money. And my treat brand will be there. I have my own brand of dog treats. It's called Caberfae Treats.
Nice.
You can find their site on our podcast page.
Gotcha.
But yeah, like that's the goal of that company is eventually to move into CBD products,
Mm,
and make a high quality CBD product for anxiety and arthritis for dogs. But we're
nice.
starting with just getting like a nice paddleboard treat down. So that's brand new to the market. High quality, homemade, human grade food.
Nice.
Yeah. So that's about
Well,
it though.
it sounds like you're doing a lot of great stuff, man.
Yeah,
Once
it's a
again,
ton of work, but
yeah.
yeah.
Well, hey, thank God for people like you because you know what? I'll tell you, I wouldn't be doing that. So thank God
Hey,
that you exist,
you're doing your own thing though. Like,
Yeah,
yeah, I
that's
mean,
very true.
you recently got into, special education and it
Mhm.
sounds like you're having a blast with it.
Yeah.
Like, so I mean, we all find our way, right?
Oh,
Like,
very
and
true.
my way is with pets, but you're making a huge impact and never downplay that.
Thanks. I appreciate
Um,
that. And I say the same to you, man, because you
thank
know
you.
what? From this conversation, you're a great guy, to be honest with you. It was a great
I
conversation.
try.
Like I said, I really appreciate you coming on, man. This was a great time and I'd love to do it again. I will go ahead and just link everything that you mentioned in the
Okay.
description. So if they're looking for that, they can find it there. But we'll see you guys on the next one. This was a great one. So appreciate it.
Thanks for having me on.
No problem.